Every single night, you perform a ritual that occupies nearly a third of your entire life. You fluff your pillow, you pull up the covers, and you settle into your favorite position. For most of us, this is the most mindless part of our day. We don't think about it, we just do what feels comfortable. But what if I told you that the simple choice of leaning toward your left shoulder or your right shoulder could be the difference between a heart that pumps effortlessly and a heart that is under constant, silent, mechanical stress? What if the way you are sleeping right now is actually forcing your internal organs to fight against gravity for 8 hours straight? Today, we are going to dive deep into the clinical science of sleep posture. We are going to look at how gravity interacts with your aorta, your vena cava, and your digestive valves. By the end of this video, you will know exactly which side is the longevity side for your heart and why one common sleeping position might be putting your cardiovascular health in serious danger. Quick note before we flip the switch on the science of sleep. I'm a health researcher, not a doctor. This is educational content. If you have been diagnosed with congestive heart failure, severe sleep apnea, or any chronic cardiac condition, please follow the specific instructions given by your cardiologist. Never change your medical routine based on a video. To understand why the side you choose matters, we first have to visualize what's happening inside your chest cavity. Most people think the heart is right in the center or maybe tucked slightly to the left, but it's not just about location, it's about the plumbing attached to it. Your heart is connected to the largest artery in your body, the aorta, which arches over the top of the heart and heads down toward the rest of your organs. This arch curves toward the left. When you sleep on your left side, gravity actually helps the heart pump blood into that arch. It's like a car going downhill. The heart doesn't have to push as hard because gravity is doing part of the work. But when you flip over to your right side, the heart has to pump uphill against the force of gravity to get that blood into the aortic arch. For a young, healthy heart, this is a minor task, but for a heart over 60 or a heart that is already managing high blood pressure, that extra 8 hours of uphill work every single night adds up. It's like leaving your car engine running at a high RPM while it's parked. If you're finding this perspective eye-opening, please give this video a thumbs up. It tells the algorithm that this kind of detailed health information is valuable for our community, and it helps me reach more people who might be sleeping their way into a health crisis. And if you haven't joined us yet, subscribe. We spend hundreds of hours researching these topics so you can stay vibrant, informed, and independent as you age. Now, let's talk about the right side risk. While the left side helps the aorta, the right side does something else entirely. It puts pressure on the superior vena cava. This is the massive vein that carries used blood back to your heart. When you sleep on your right side, the weight of your other organs can slightly compress this return line. Imagine trying to drink through a straw that has a tiny kink in it. You can still get the liquid, but you have to suck harder. Your heart has to work harder to pull that blood back in. For people with a condition called heart failure with preserved ejection fraction, a very common issue as we age, this small mechanical disadvantage can lead to fluid buildup and increased pressure in the lungs. Have you ever woken up feeling slightly short of breath or noticed that your ankles are more swollen in the morning? It might not just be your diet, it might be the kink in the straw caused by sleeping on your right side. I'm curious, which side do you naturally gravitate toward? Do you wake up in the same position you fell asleep in, or are you a toss and turner? Let me know in the comments. I read every single one, and seeing your patterns helps me understand how we can better optimize our rest together. But wait, it's not a one-size-fits-all answer. For some of you, the left side actually carries a different kind of risk. There is a phenomenon called mediastinal shift. When you lie on your left side, the weight of your right lung and the space in your chest can cause the heart to shift slightly and even rotate. For most people, this is harmless, But for individuals with certain types of arrhythmias, like atrial fibrillation, AFib, this slight rotation can trigger an episode. In fact, many AFib patients report that they cannot sleep on their left side because they can feel their heart thumping or flopping against their ribs. If you feel your heartbeat too intensely or feel skipped beats when you lean left, your body is sending you a signal. In that specific case, the right side might actually be your safe harbor. This is why listening to your body is more than just a cliché, it's a biological necessity. We also have to talk about the acid reflux connection. Your heart and your stomach are neighbors, separated only by the thin wall of the diaphragm. The esophagus enters the stomach at an angle, usually toward the right. If you sleep on your right side after a late dinner, the acid in your stomach sits right against the valve that leads back up to your throat. Gravity literally pulls the acid out of the stomach and into the esophagus. This causes heartburn, which is often mistaken for actual heart pain. More dangerously, chronic acid reflux can trigger the vagus nerve, which, as we've discussed in other videos, is the main controller of your heart rate. An upset stomach on the right side can lead to a racing heart or palpitations at 2 a.m. Sleeping on the left side, however, keeps the stomach below the esophagus, using gravity to keep the acid where it belongs. So, what about sleeping on your back? This is often called the royal position, but for many seniors, it's the most dangerous position of all. When you lie on your back, gravity pulls the tissues of your throat and your tongue backward. If you have even a mild case of sleep apnea, this position virtually guarantees that your airway will partially collapse. When your airway closes, your oxygen levels drop. Your brain panics. It sends a massive jolt of adrenaline to your heart to wake you up just enough to breathe. This happens dozens of times an hour, and you might not even remember it, but your heart remembers. It's like being startled by a loud noise every 5 minutes while you're trying to rest. This back-sleeping stress is a leading cause of high blood pressure that doesn't respond to medication. If you must sleep on your back, perhaps due to hip or back pain, you need to use the incline strategy. Propping yourself up with a wedge pillow or an adjustable bed by just 10 to 15 degrees can keep the airway open and reduce the pressure on your heart. But for the majority of healthy seniors, side sleeping is the gold standard, specifically the left side, unless you have that AFib sensitivity I mentioned earlier. Now, how do we make this practical? If you've spent 60 years sleeping on your right side, you can't just tell your brain to stay left and expect it to happen. You need sleep anchors. This is where a long body pillow comes in. By placing a firm pillow against your back when you lie on your left side, you create a physical barrier that prevents you from rolling over onto your right in the middle of the night. You can also place a pillow between your knees. This doesn't just help your hips, it aligns your spine, which reduces the twisting tension on your chest cavity, giving your heart more room to beat freely. Let's also connect this to our previous discussions on magnesium. As we know, magnesium is the handbrake for the nervous system. If you take your magnesium in the evening, your muscles, including the tiny muscles between your ribs, relax. This makes it much easier for your rib cage to expand and contract. When your breathing is easy, your heart has to do less work to oxygenate your blood. The combination of the left side position and magnesium relaxation is like a spa day for your cardiovascular system. If you haven't watched my video on the best types of magnesium for sleep, you should definitely watch that after this one. We also need to consider the glymphatic system. This is the waste clearance system for your brain. Recent research suggests that this brainwashing process is actually more efficient when we sleep on our sides compared to our backs or stomachs. By choosing the correct side, you aren't just protecting your heart, you are helping your brain clear out the proteins that are linked to memory loss and cognitive decline.
Your heart pumps the blood, but your position determines how well that blood cleanses your most vital organ. Maintaining heart health after 60 is about managing the micro-stressors. A single night of sleeping on the wrong side isn't going to cause a heart attack, but 365 nights a year multiplied by a decade, that is thousands of hours of unnecessary mechanical stress on a pump that has already been working for 60+ years. You wouldn't drive your car with one foot on the brake for 10 years, would you? So why would you sleep in a way that puts the brake on your heart's efficiency? The sweet spot for most of you is the left side, with a pillow between the knees and a support pillow behind the back. This position optimizes the aortic arch, keeps the stomach acid down, and allows for maximum lymph drainage. If you feel palpitations on the left, move to the right side, but avoid sleeping flat on your back if you snore or feel tired during the day. Your heart has been there for you since before you were even born. It hasn't taken a single second off. Giving it the gift of a gravity-assisted night of rest is the least you can do to say thank you. It's a small change, a simple tilt of the body, but the long-term rewards for your longevity and your energy are immense.
I want you to try the left side challenge tonight. Use a pillow to anchor yourself. Pay attention to how you feel when you wake up. Are you less stiff? Is your breathing clearer? Does your heart feel quiet in the morning? Come back to this video in a few days and let me know your results. If you found this guide helpful, please share it with a friend or a family member. Heart health is something we all share, and sometimes a simple tip about how to lie down can save someone a lot of trouble down the road. And don't forget, if you want to pair this posture with the right mineral support, watch my video on the handbrake effect of magnesium next. It will show you how to calm your heart rate naturally before you even hit the pillow. Take care of your heart, sleep well, and I'll see you in the next one.